Hi, and welcome to this video on childhood immunization. We're going to look at what ages different vaccines should be administered to children. The act of immunization is something we gladly take for granted in the modern era. But it wasn't always this way. Diphtheria was a dreaded childhood disease that took the lives of approximately 10,000 children in the U.S. in the 1920s, and polio paralyzed or killed thousands of children in the 1940s and 50s. Today, vaccines play an important role in keeping us healthy and preventing diseases like the flu. At birth, babies have some of the mother's immunity passed on to them. But shortly after birth, it is recommended by the Centers for Disease Control, Advisory Committee on Immunization Practices, and the American Academy of Pediatrics to have children immunized against potentially deadly diseases. As children become social and go to school, vaccinations can help prevent epidemics and pandemics of great public health concern. So let's talk about the vaccination schedule currently recommended by the CDC and ACIP. The first vaccine a child receives at birth is hepatitis B. From birth to 2 months, vaccines are typically given during the baby's first well visit. These vaccines include their second dose of hepatitis B, rotavirus, diphtheria, tetanus, pertussis, referred to as DTaP, Haemophilus influenza type B, often referred to as Hib, pneumococcal conjugate, and inactivated poliovirus. At 4 months old, the baby should receive their second dose of everything that they received at 2 months, except hepatitis B. A baby that is 6 months old to 15 months old can get their third dose of DTaP, pneumococcal conjugate, and inactivated poliovirus. At this time, the child can also receive their first dose of the flu vaccine. At 1 year old, the child can receive vaccinations for measles, mumps, rubella, also known as MMR, varicella, and hepatitis A. At 18 months old, the child can be given their third dose of hepatitis B and their fourth dose of DTaP. They can also be given their third dose of the inactivated poliovirus if it was not given at 6 months. At 4 to 6 years old, the child can receive their fifth dose of DTaP and the poliovirus and their second dose of MMR and varicella. Something to keep in mind is that most vaccinations are given before the age of 6. This is to prepare the child for entering school in the hopes of decreasing the spread of communicable diseases among other children. At 11 to 12 years old, the child can be given the meningococcal vaccine and their sixth dose of DTaP. A second dose of meningococcal should be given at 16 years of age. The CDC recommends this due to children between the ages of 16 to 23 being at the highest risk for meningitis. This is also to prepare the child for dormitory life if college is the next step after graduation from high school. Studies have shown people living in close quarters like college dorms or barracks in the armed forces are at increased risk. HPV vaccine is also promoted during this time, as there has been a link between human papillomavirus and the incidence of cervical cancer. There is a great deal of information on administering vaccines safely and effectively. The child should be screened for adverse effects, allergies, and illnesses. The parent and child, if applicable, need to be educated on the vaccine itself and what to expect before and after administration. Currently, in the United States, children are vaccinated for approximately 17 preventable diseases. Consent needs to be obtained by the parent or guardian prior to vaccine administration. Anytime the child goes to routine doctor visits or is hospitalized is a good time to check and see if vaccinations are up to date. Keeping accurate vaccination records is also beneficial so that vaccines can be spaced safely apart and caught up if needed. Thanks for watching and happy studying!